This exercise is a low back mobilization that you can do for yourself, focused on the joint mobility, going into side bending, really side bending with some flexion. So it's what we call opening. Generally puts a little bit more space between the facet joints or the joints on the side of the vertebrae. So it tends to be one people like if they've got a bit of a space issue kind of near the spinal cord. So we're going to lie down on one side, and if I've set this one up with you, I'll tell you which side in your individual instructions that we want you on. So I'm on my left side, that means I'm going to be working the right side opening. In the clinic, I bend people's legs up to roughly the position where I feel like that spot in their back is starting to round, just to try and target that level of the vertebrae. And then I take you can take those legs and let them hang off the side. And what you'll see here, if you look at my belt line here, if you can see it over my belly, is that my pelvis here kind of tips down that way. So between my hip and my shoulder, the space lengthens. So that's that opening we were talking about. You can do a little bit of a wiggle at the bottom to try and help those muscles relax if they're tight. I wouldn't do an excessive, back and forth. That's not really ideal, but just a little wiggle to make them realize if they're holding tight. And then you kind of come back up onto the table, letting that kind of pull you into that side bend. Okay? So that's that mobilization. Usually in the clinic, I do it by pulling the legs up and having you lie on the other side. But it's the same basic idea. This is just easier to do on your own.